Religion? How you doing with you? Coming back. Passion. I know, right? Down here. Hey folks, I'm here today again with our good friend here, Dr. Ian Grayson. Ian, thanks again for joining me, and you have a nice program for us that is going to be about how not to get sued. I mean, could you have found a more positive way of spinning it?
Well, it doesn't ensure that you won't get sued, but if you were to have a problem, by following these steps, you'd minimize the damage.
Yeah, that will be key. What I have found in my experience that it's all about communication and transparency and being clear. But you tell me, what is in your experience the most important thing?
It's very, very simple. It boils down to 3 items. When you're practicing, practice at the highest level you possibly can. So have excellent diagnostic, excellent clinical skills, and when you combine that with great communication and great listening skills, it's very, very important to listen to what the patient expects, what they want, and not to deliver a service which you perceive to be more important, but address the patient's concerns. And lastly, accurate recording of all your discussions and keeping great records, x-rays, consent forms, chart notes. As long as you're doing that kind of thing, you're probably unlikely to run into a problem.
And that's a very good point, Ian, about the quality of care you render. It's important to kind of qualify the term standard of care, right? Standard of care is a legal term, which is the standard at which anything below that would be considered negligence.
Correct.
And that legally means that you basically are liable for any...
We want to be at the standard of care, but certainly as practitioners, we want to be well above that. Right. And we are in fact our own quality control.
Absolutely. Standard of care is the minimum required.
Correct.
But I hope that none of us are practicing at the standard of care. We want to be at the level of proficiency, or better yet, excellence.
Correct.
And that's really the goal here. So, and then you render your care, and then from that spins out, these issues of transparency, communication, and understanding of the patient, and then your records, because as the old saying goes,
if it's not written, it didn't happen.
Absolutely.
So what we want to do is we want to make sure, and we want to have this perception in our minds that everything we do, a third party is standing over our shoulder, and how will they interpret our notes and our procedure? Are they going to be favorable or unfavorable? We want them to be favorable all the time. Well, what I'm going to do is I'm going to take you through when a patient first walks into the office, how we manage that, how we handle that, up until the point where we present our treatment plan.
Okay, go ahead.
Okay, so the first thing we do is, and this is often neglected, is taking a great medical history. And a medical history is not just a piece of paper that you hand to the patient, they fill it in the reception area, and you file it away. A medical history has to have certain elements. It has to have all the medical conditions that patient has, which affects his present condition. It has to have all the medications that he's taking, any medications that he's allergic or sensitive to, and also very important in today's day and age, any type of habits, recreational drugs, smoking, chewing tobacco, because these all contribute to potentially our procedures that we do. And once you've gone through everything, if there's anything you don't understand, certainly an MD consult is appropriate, but once you've gone through everything, you sign it, you date it to ensure that everybody knows that you've reviewed it.
Right.
And the next thing that we're going to discuss is we want to sit down and we want to talk about the patient. Patients always love to come in and talk about what's bothering them. And this is the case where you become a great listener. Listen to what the patient expects from you, what their expectation outcome will want to be, and then pick up clues as to what the problem is. Often by listening to the patient, we can determine, well, it's a lingering pain or it wakes me up at night. We can determine the diagnosis right then and there. So that's why it's very, very important to listen well.
Right. And then the past dental history and so on is also...
Of course. If a patient went in to his general practitioner 2 weeks ago and had a crown done, and ever since then he's had a problem, that guides you and leads you to a conclusion. If a patient went to a movie theater and was snacking towards the bottom of the popcorn, you know what happened there.
That's right. That's not a pleasant thing.
No.
So, I mean, essentially it goes back to diagnosis, and I think these essence of your chief complaint, your past medical history, your history of present illness or past dental history, and the medications and things that they all take, part of that patient interview process that occurs, that's also important in terms of not just for your diagnosis, but then recording it and having good records of it for your, cover your back kind of.
Exactly. You want someone who looks at your chart in an objective sense to be able to determine exactly what you did, how you explained it, and why the outcome was the way it is. And that's the important thing. We always have to be thinking about that. And then
by the way, sorry to interrupt, but these are the standards. I mean, this is the standard of care. You have to do it, and you have to record it. Right. And so in that way, it really has to be systematic in your charts.
And everything you do, from your examination, your probing, your use of explorers, all your testing should be notated. Usually in a chart form, you can have pre-existing charts where it's a template and write it in. And then comes the important part, sitting down with the patient and explaining your findings and talking about what can be done. And this is one of the most important things and definitely must be notated. So what you do is you explain your diagnosis, you tell them why it is the way it is, and you give them a treatment plan. And this does not necessarily include one form of treatment, it includes several treatment options. Each time you talk about an option, you discuss the risk-benefit ratio for each one. And finally, what you want to do is you want to talk about the cost. This is very, very important. The patient must know up front what it's going to cost. And lastly, you want to talk about what the consequences are of not doing any treatment, because it's important to know if you have an infection, well, it can spread and cause a serious problem for you if you don't treat it. So if you do all that, notate it, then have a consent form which echoes exactly what you've described, I think that that's a very complete informed consent.
Yeah, definitely. And then, especially when it comes to cost, for example, many dentists are kind of shy to discuss costs. If you have a manager, somebody else could do that for you, but it's important for everything to be kind of not only communicated, but written down and signed in the form of the proper consent in the cost. And recently we had actually a new law passed in Massachusetts that requires for patients to just have that understanding, so that it's not like you just do whatever you want to do in the operatory and the patient goes out to the front desk and gets surprised.
Right.
So that's a no surprise kind of a law, if you will, that everything has to be clear. And it just makes sense.
And that's one of the principal causes of complaints and potentially lawsuits, is when a patient believes they've been taken advantage of, especially on a financial level, that's going to lead to a problem.
No, absolutely. Financial problems tend to be the main
the driving force behind many of these lawsuits. Yes.
Exactly. So what else?
That's basically it. So, well, just to review, you want to have great communication so that the patient understands everything about the procedure. They know what the procedure is, they know the risks, they know the benefits, they know the costs right up front before you do anything. Have it all in writing on a consent form, and have all your discussions within your chart, either the electronic version or the written version. And once you have those three elements, then you're very much on your way towards having something which, if a third party looks at it, you're pretty much looked after.
Awesome. So you want to, let's come back and you can show and share a couple of cases
where
we can get into a little bit more detail on these big fronts. All right, we'll be back with Dr. Grayson.